Hello, and welcome to today's webinar about what's next, clearing up confusion around the COVID-19 vaccines. My name is Emily Gustafson. I am the Vice President of Digital Strategy and Public Education at the American Hospital Association and project lead for AHA's vaccine confidence work. This event was funded in part by a cooperative agreement with the Centers for Disease Control and Prevention. The contents of this resource do not necessarily represent the policy of the CDC or HHS and should not be considered an endorsement by the federal government. Today's webinar comes at a particularly important time as we head into the 2023-2024 back-to-school season, and confusion still exists, including in the provider community around the process of receiving the COVID-19 vaccine and booster. Today, we're going to hear directly from the CDC and other experts in the field about what vaccines are available, for who, and when they should be promoted to patients. I hope that you will all leave this discussion with answers to the commonly asked questions and strategies to increase COVID-19 vaccination rates for children under 5 and others within your community and beyond. During today's conversation, we'll start by speaking directly with the CDC experts to hear more on the national perspective on COVID-19 vaccine immunization schedule and the current situation. We will then turn to a panel of hospital leaders to share their experience and perspective on the current situation. I will wait to introduce them until the beginning of their panel. We will then all come together near the end for a group discussion and to answer your questions. As they arise throughout this program, please enter them in the Q&A box so we can answer as many as we can when we get to the end of the program. Okay, let's get started. Now I'm pleased to introduce you to our first speaker from the CDC. We have Dr. Joanna Regan, who is ACIP and COVID-19 vaccine work co-lead for the Vaccine Effectiveness and Policy Team, Coronavirus and Other Respiratory Viruses Division, and for the CDC. That's a long title. We're so pleased to have you, Dr. Regan, and we're going to hear from you a little bit on the national perspective and where we are with the current immunization schedule. So I turn it over to you.
Thank you so much. So yes, again, I'm Dr. Regan. I'm a pediatrician. I've been here at the CDC for the past 15 years, and I'm going to talk to you today about the COVID-19 vaccination schedule. Next slide. So I'm going to give you an overview of current recommendations. Next slide. So first, we're going to talk about the simple and singular recommendation for most people. Next, the flexible recommendation for people at higher risk. Then we'll talk about the customized recommendations for young children, and then the changes that we anticipate to happen in the fall. Next slide. So let's start off by talking about those simple and singular recommendations for most people. Next slide. So we think, it couldn't be easier at the present for a majority of people, especially adults. So the current recommendation for people age 6 years of age and older without immunocompromise who have not yet received a bivalent mRNA dose, the recommendation is just one bivalent mRNA dose. Next slide. So for any of these categories, people who've had Moderna, Pfizer, one or more doses of Janssen, or if they've had no vaccine at all, it's still just one bivalent mRNA dose. Next slide. The current recommendation, again, once they have that one bivalent mRNA dose, they are considered complete, and no other doses are indicated at this time. Next slide. Now let's talk about the flexible recommendation for people at higher risk. Next slide. So for people who are 65 years of age or older, and they have not yet received a bivalent mRNA dose, then they would receive one bivalent mRNA dose. But then they have the option to receive an additional one, but to wait at least 4 months after the first. So they have that additional option. Next slide. Next slide. So then for people who have immunocompromise, if they're 6 years of age or older and they have immunocompromise, this is the recommendation for them. So the recommendation is still one bivalent mRNA dose, and then after they complete that, 2 months later, they can have an additional dose. And then for certain groups, there would be a recommendation to perhaps have another dose after 2 months. And that would be for people who had stem cell transplant, chimeric receptor T cell therapy, or CAR T therapy, B cell depletion, or other forms of immunocompromise. Next slide. Now let's talk about the more complicated portion, which many of you are probably interested in as pediatricians, the customized recommendations for young children. Next slide. Next slide. So they're broken down by age and immunocompromised status. So for children without immunocompromise, age 6 months through 4 years, the doses that are now recommended are that they have at least 2 Moderna vaccine doses or 3 Pfizer vaccine doses in total. And this should include at least 1 bivalent dose. Next slide. So we have these helpful infographics that I hope you all have found. They're attached to our interim clinical considerations for the COVID vaccine on the CDC website. And as you can see, for 6 months through 4 years, if you look at the unvaccinated section, which is the first 2 vials, it shows you the number of doses for both Moderna and Pfizer. And then it also goes on to give you the number of doses needed for any iteration of vaccines they've received in the past. Next slide. Then we'll talk about age 5. So for children that are age 5, it differs for the 2 formulations again. So for Moderna, it's at least 2 vaccine doses in total, including at least 1 bivalent dose. And for Pfizer, 5-year-old children, they're just supposed to receive at least 1 bivalent dose. Next slide. And so again, we have this helpful pictogram, which shows the doses that they need, 2 for Moderna or 1 for Pfizer. And notice that these pictograms also include the color of the vial, and at the bottom of the vial, it gives the concentration of the vaccine as well. Next slide. So for children, or for all individuals 6 years and older without immunocompromise, Moderna and Pfizer are the same. It's just 1 bivalent dose. And again, for people 65 years and older, they can opt for that additional dose after the first one after 4 months. Next slide. And again, this is a pictogram that shows children 6 through 11. And why this is has a different pictogram than the rest of the population is notice at the bottom of these vials. So the concentration is given here. And then next slide, if you see 12 and up, it's still just 1 dose, but the concentration documented at the bottom of these vials is different once you go to 12 years of age. Next slide. So now let's talk about the fall and steps towards that recommendation. So on June 15th, FDA's Vaccines and Related Biological Products Advisory Committee, or VRBPAC, met to discuss fall strain composition. And VRBPAC unanimously voted that the vaccine composition be updated monovalent COVID-19 vaccine with an XBB lineage of the Omicron variant. And the reason for that is that the original Wuhan strain is no longer circulating. And this XBB lineage, it should be noticed, you may be hearing other lineages or other variants named in the media, et cetera. However, they're all within this XBB lineage and closely related and thought to be covered by this upcoming vaccine. So FDA advised manufacturers to develop this vaccine with this monovalent XBB 0.1.5 composition. And it's anticipated that updated vaccine doses will be broadly available in the fall. FDA and ACIP are discussing ways to simplify those pediatric dosing, because we do realize it can be complicated for parents and providers. And then following updated vaccine authorizations, ACIP will review evidence to inform updated recommendations. Next slide. So in summary, COVID-19 continues to cause substantial morbidity and mortality across the population, particularly in older adults and persons with immunocompromising conditions. COVID-19 vaccines continue to be the most effective tool we have to prevent serious illness like hospitalizations and deaths. And COVID-19 vaccination is important for pregnant people for the protection of themselves and their infants. An ongoing review of data needs to be done to continue efforts towards simplification. FDA advised manufacturers to develop vaccines with a monovalent XBB.1.5 composition, and ACIP can discuss future vaccine recommendations at upcoming meetings following the updated vaccine authorizations. Next slide. So that concludes my presentation. Thank you.
Thank you so much, Dr. Regan. That was really helpful. And we will see you back later in this presentation for a question and answer portion. Thanks so much. Okay, now that we've heard a little bit about the national perspective and our current immunization schedule, we are going to change it up a bit, and we will welcome some of our hospital and health system members to join us and have a conversation about what's happening in the community and with patients about vaccinations. So we will welcome Dr. Angela Myers and Dr. Sarah Ritchie to the program. Hello. Thank you so much for joining us. We're so excited to have you guys here today. So let's start with hearing a little bit about you. I'd love to hear a little bit about yourself, your hospital, your role, and then of course the patient populations that you serve. Why don't we start with you, Dr. Myers?
Sure. Hi. Thank you for having me today. I'm happy to be here. I work at Children's Mercy in Kansas City, so across Missouri, the Missouri side and Kansas side, where they join together. I am the Division Director of Infectious Diseases here at this hospital, and my role is mostly to see patients in the hospital with infections. And we see children of all ages, and of course, children who are previously healthy with food infections, but also children who are undergoing transplants, including bone marrow, solid organ, and all of those things as well. So we see a variety of different patient populations.
Great. Thank you so much. And thank you for joining us. We're excited to hear from you. And Dr. Ritchie.
Yes, thanks so much for having me. I am a general pediatrician with the Medical University of South Carolina. We're located in Charleston, and I lead one of our general outpatient pediatric faculty practices, and I supervise the residents in our continuity clinic, and I round in the newborn nursery. Our patient population is majority Medicaid. We've got pretty diverse ethnic backgrounds here in the sort of Tri-County Charleston area. I myself am Latina and I speak Spanish. We have a pretty large group of hospital staff and their families that we serve as well.
Great. Wonderful. Well, thank you so much. And welcome to you too. We're happy to have you both. And I think where we wanted to start was, one of the things that's marked this this COVID-19 pandemic has been the different intervals, right? Where we have been and what that means for patients and their immunization journey. So I'd just like to hear a little bit about from you two where we are right now with your patient populations regarding the COVID-19. What are some themes that you're seeing? We can start with you, Dr. Myers.
Sure. So, I am old enough to have been around during the 2009 influenza pandemic. I was junior faculty at that time. And so folks will take a little journey down memory lane with me. Back during that time when that first started happening, there was a huge desire for a vaccine for that strain, that H1N1 2009 strain. And of course, it took some months to get that manufactured and up and going and distributed. And since that time, there, as things happen, the desire has waned, right? And so I feel like that a similar story has happened with COVID. So there was this huge desire for a vaccine in the early stages of COVID. and people worked incredibly hard to rapidly develop it. But as that happens, and there were some people so grateful and thankful to get it, then there was also some other things that happened, and desire, again, in some pockets and in areas, and decreased. And of course, now more than even in the past, there has been misinformation that has kind of been propagated, which has damaged, I think, some trust in the medical establishment, and around vaccines in general, which has been unfortunate.
Yeah, for sure. I think that we've seen them go up and down, right, through the last 3 years, and where people are. And I think one patient population that's been really interesting to watch is, of course, pediatrics, and to hear from our parents of all these kiddos and where they stand with the vaccine. Dr. Ritchie, are you hearing similar things and seeing those similar themes in your community? And is there any difference with the parent populations that you're seeing?
Yeah, unfortunately, it is a pretty similar theme. One thing I kind of remain hopeful about, though, is I find that some of my parents who were borderline, as time continues to go by and we continue to show safety and efficacy of the vaccine, they start to sort of come around a little bit. And so I remain hopeful about that patient population as one that I can actually have some effect on, and continue to build their trust in that way. But yeah, it is a pretty similar situation.
Yeah, it's a bummer. So I wonder, with hesitant populations specifically, as we think about parents and vaccinating kids, has there been any themes with those particular groups, like people that have remained hesitant, that you're just not seeing go away, that we're still struggling with at the point of care when we go to talk to them about the importance of the COVID-19 vaccine? Go ahead. Why don't you start, Dr. Myers?
Okay, so I will say that I think that the myocarditis concerns that were around early on have really dissipated, which is wonderful. I do think there's still some small pockets of people out there that bring up this concern of fertility issues, unfortunately. And there are just some, I think, pockets of people who just don't believe it's necessary, or it's needed, or it's that effective. And I think part of that is on us as the medical establishment, or the people taking care of patients, that we have a lot of vaccines that just prevent disease outright, and that is fantastic and amazing. And they have done just phenomenal things, right, to decrease the burden of disease for many, many diseases. But not every vaccine does that, and not every vaccine can do that. And that's okay. Some vaccines are just meant to prevent serious illness and hospitalization and death. And understanding the difference there is really critical, right? What this vaccine is able to do and designed to do versus what the measles vaccine can do, or the Hib vaccine can do. And that is somewhat on us to do a better job, I think, of conveying that information and helping people understand it more clearly.
Yeah, that's such a great point. The need to really remind people we're trying to keep them out of the hospital, keep it less severe, that it's not necessarily going to make it go away entirely. Dr. Ritchie, did you have anything to add on that one?
Yeah, and absolutely. I think to kind of piggyback on that, I really love in pediatrics the concept of anticipatory guidance, because that comes up all the time in every kind of visit, whether it's a same day or a well check. And we might be using it to talk about milestones. Here are the milestones we're hoping your child is achieving today. I'm going to see you in 2 or 3 months, and here are the milestones I hope they are achieving then. But I also like to keep procedures and vaccines in that conversation too. So really empowering the parents to feel like they're coming in confident that they know what we're going to be recommending and what we're going to be talking about, which would include the COVID vaccine. And they can have their questions ready and not feel like they're getting surprised by what we're going to talk about.
Yeah, for sure. I love that. Being able to pepper and leave breadcrumbs so people know what's coming, and that they're not surprised by the conversation, and they're ready to go when you're, say it's time for them. to get vaccinated. So building on that, those are some nice strategies I think that providers can use when starting those conversations on the importance of immunization and specifically with COVID-19. Have you guys seen or developed yourself some additional effective strategies to have more productive conversations? Like, as Dr. Myers alluded to, I think that we all know there are some people that are hesitant and they might never get the vaccine, and that is okay. But particularly with people that are on the fence, or with parent populations or others that just have questions and that continue to kind of go back and forth. Are there some strategies that you've used that you've found effective, or that your hospital has implemented to keep this top of mind for people, and to make sure that when we see them at a well visit or at another visit, we can get them in line and up to date with their vaccinations?
Sure. Yeah, absolutely. So one of the strategies personally that I've used, and I think our team uses when we're consulted on a patient in the hospital, is making sure that we have checked their vaccine records and we know where they are. Are they current, or do they have ones they need to catch up on, and all of that, and facilitating that conversation with families. We try really hard to ask if they kind of voice hesitancy, is to ask what their questions are, what are your concerns, what is it you're most concerned about, and could we talk about it. And we try to give people that space for us to come back at a different time, or even a different day, subsequently in that hospitalization, especially as their child gets better, or gets well and is nearing that discharge date. Parents are oftentimes more willing to have that discussion or think about those things or have a conversation once they know the primary reason the child's in the hospital is improved or gone. As an institution, we have worked really hard to increase the ability for the orders to be written by pharmacists and things like that, so that things don't fall through the cracks. So, occasionally in the past, we've had parents who's like, I didn't even know my child was behind, or I didn't even know they were eligible for this vaccine, or it's not required for school, so we hadn't gotten it. Yes, I'm interested in getting it. And then somebody forgets to order it before their discharge, right? So that's a missed opportunity. And we've tried really hard to close those gaps so that it actually does get ordered and it actually does get given. And, all of that is wrapped up. And that sounds so simple, but there's a bunch of steps, kind of in that process.
Yeah, I love that. And technology is our friend, right? It certainly can help us create a paper trail, literally electronic one, and follow up with people. And I certainly know, as well as a parent, when your kid is sick, all you want to do is have them get healthy again. So that is an interesting time for a clinician to say, you want to keep them healthy? Hey, why don't you take the opportunity and get a vaccine? So there's certainly a window there and an opportunity. Dr. Ritchie, did you have things to add there?
Yeah, I will add to using that technology. A lot of electronic medical record systems will fire reminders about vaccines that children are due for, and so that pops up when we open the chart for the provider. But it also will fire through their personal medical records, so they'll get an email saying your child is due for maybe some of these vaccines. Sometimes it's dental varnish, whatever the case may be. So that's been nice. I have a lot of families who come in and say, well, the computer told me I was due. So that's great. And we also run reports and we'll mail postcards as well, just to reach parents that way. I think a couple of other things I will add for me personally as techniques to try and reach some of these families. I like to use the concept of partnership. So really emphasizing the idea that I'm partnering with the parent to help make the best health decisions to protect their child and keep their child healthy. And we're doing that together. And this is a joint decision. And I think that goes over really well with parents, and making sure that I'm emphasizing that the parent is doing a really great job taking care of their child and maintaining their health, and that we're here to support them, so that we can just sort of have that rapport as we're venturing into these vaccine discussions. And maybe one more thing too, I like to share my personal plans. So what the status is of my own children, and when they were vaccinated, and what my plan is for the fall, or whatever the case may be for vaccinating my own family, just to help continue to build that rapport.
Yeah, that's wonderful. I think it's so important for us to connect with patients, for providers to be able to both be the trusted expert, but also be seen as a peer, right? And somebody that you can trust, a neighbor, a community member. So your advice goes that much further. Okay, wonderful. Well, thank you for that wonderful discussion. We're excited to keep this going. So we will welcome back Dr. Regan and open this up to a larger discussion. We are also going to invite an additional participation from Dr. Catherine Fleming-Dutra from the CDC to enhance this discussion and hopefully help us dive into a few new themes. So welcome back, and hi, everybody. So we're going to start asking some additional questions. Again, I encourage you guys to jump in and build off each other's answers. So Dr. Regan, we will start with you. No surprise here, there's a lot of fatigue around the COVID-19 vaccine and COVID in general, quite frankly. So one of the questions I think we hear a lot, and I'm sure you guys hear a lot as well, is what is the definition of being fully vaccinated?
That's a great question. So yes, we do hear this question a lot, and I think a lot of people were confused by fully vaccinated. So for vaccines like COVID and influenza, which may have recurring doses, that sort of terminology can be a little confusing. So we've switched to up to date. So people, should tell their patients that they should be up to date. And up to date is, for patients 6 months and up, they should have the recommended doses, including at least one dose of the updated bivalent vaccine.
Okay, great. Up to date. That is helpful. Everybody remember that. That's very helpful. Thank you. And to all of our folks listening on the web, I just encourage you, please add your questions into the Q&A box. We're going to get through a few right now, and then we're going to start adding yours into the mix. So if you have anything you want to ask any of our panelists, please just throw it in there. So we will keep on moving. We will head to you, Dr. Ritchie, on this one. And again, please others jump in. But curious specifically on how you're addressing misinformation. As we talked about, that seems to be prevalent and has been for the past few years. Specifically with your patients and communities related to COVID-19. How are you kind of coming at that?
Yeah, I kind of like to pair this in when I'm talking about screen time, about for all of our pediatric patients and what's a good amount or not. And I just like to point out that the internet is a funny place, and you can find a positive answer to whatever thought you might be having, something to support thoughts that you might be having. You can find that on the internet. And so I think it's really important to direct parents to safe parental controls for their children, but also safe websites. And so I kind of pair it like that so that they can sort of see what I'm talking about with keeping themselves safe on the web as well as their children. And so websites like the CDC or healthychildren.org, which is the American Academy of Pediatrics website for parents, just as great places and really safe places to ask your questions.
Thank you. That's really helpful. I'll open it up because I know misinformation is something that, gosh, we can't stop talking about because it continues to remain a theme here in the COVID-19 battle. Anybody else want to jump in on this one?
Sure. From a standpoint at the hospital and kind of for the public, we engaged in a lot of different media experiences to try to help answer those questions and also dispel those myths. We've created some kind of online content as well, kind of to what Dr. Ritchie's speaking about that the AAP does, and so does the CDC. But for our hospital, public-facing website for parents to go to and get those things answered and questions. And we made short video spots explaining things, trying to do it in language that would be very understandable, that didn't have a lot of medical jargon in it. and things of that nature to really try to help. And then also to arm people with how to respond when they receive that information and they think, well, that doesn't sound quite right, but they're not really sure what to say or what to do with it. So hopefully that helped people even outside of the medical field feel empowered to question or to kind of second guess kind of things they're hearing that don't sound right.
Yeah, absolutely. Thank you for that. And Dr. Myers, well, actually, we'll just stick with you on this. So, moving forward, I think healthcare organizations and providers are heading into the summer thinking, how can we continue talking about this? How can we get our patients and our parents ready for the school year, ready for the next flu season, and encourage them to get themselves vaccinated? From your perspective, what's the one thing that a healthcare organization, a hospital, or a health system can do as we prepare to have these discussions heading into another back to school season that includes COVID and the flu?
Absolutely. So, I'm not a general pediatrician, but my husband is, and I think general pediatricians are the best thing ever. And I know how busy the summer months are for physical season. So not only are there always new babies being born every day of the year, but the physical season is huge, right? Preparing to go into the next year. And they are inundated throughout the summer months with that. And having the opportunity to say, obviously influenza vaccine is not available right now for the fall, but it's going to be. And we are also going to be talking about making sure you've had your bivalent COVID vaccine, and we could do those the exact same day,
Right.
and trying to put that seed in there, like Dr. Ritchie mentioned, and then hopefully be able to bring them back when the flu vaccine is available, and to get everything taken care of at that time. And I know that that's hard because, right, it's hard to get people sometimes to come back. And Dr. Ritchie talked about a variety of great ways to make that happen. But I do think having those conversations multiple times leading up to is helpful.
Yeah, that's great. I think, Dr. Ritchie, what I'm going to steal from you is the anticipatory guidance, right? Yeah, creating the breadcrumbs, getting people ready. I love that. I'll see if our colleagues at the CDC want to add anything about the one thing that you think healthcare organizations or providers should think about and encourage parents to do as we head into, another flu and COVID-19 season.
While they're thinking, I will just add that one thing I really like to do is focus on concrete follow-up. So I will send them to the checkout with a plan to schedule the nurse visit to get those vaccines. I know where they're going to be available mid-October in my hospital. So I just go ahead, let's get it on, mid to late October. Let's go ahead and make the appointment.
Yeah, that's wonderful. Using the technology again to our side and those reminders. I know it helps me when it pings me. It's like, okay, I knew I had to do it, but I didn't actually schedule the appointment. So that's a really effective strategy.
Yeah, and I'll just add that, as we're getting, right now, thankfully it's not the respiratory virus season, but, we are heading back in, as school starts and heading into the winter, we do anticipate, increases in circulation of respiratory viruses. It is really important for, parents and families to do everything they can to protect their children. And COVID-19 continues to be an important cause of illness and severe disease in children, and vaccination is the most important strategy we have to prevent bad outcomes from COVID-19. So I know I'm preaching to the choir here, but remembering to remind those families that vaccination is the best way to protect your child from COVID-19.
Yes, for sure, and at every opportunity we can. So just moving into kind of another theme here. There's a lot of concern, right, with folks around the timing of shots, of boosters, especially with people if they've experienced a breakthrough infection. Dr. Regan, I wanted to ask you, if someone's ready to receive their fourth booster and had a recent infection or a breakthrough infection, should they delay receiving their booster for another 4 to 5 months? I think we're asking this question, in part because people are doing these calculations and they're wondering, like, should I game the system? Should I wait? Should I not wait? And I know we keep hearing from AHA members and providers, like, these are the things patients want to know. Should infection prevent someone from getting a vaccine? Should they wait?
So there's a couple things to unpack there. So as others have stressed before, these vaccines do a great job of preventing hospitalization and death, and that protection is sustained. But protection against infection is modest and relatively short-lived. So people are getting, breakthrough infections, as we all know, unfortunately. And, the things to keep in mind around then getting another vaccine dose. If someone has been exposed to someone with COVID, either they think they were or they know they were, they can still go ahead and get a COVID vaccine. It's totally fine. If they have COVID-19 infection, then really they should wait until they recover from the symptoms of that illness before getting it. And if they tested positive and they were asymptomatic, they would typically wait as well. So they can, as soon as they recover, go ahead and get a dose of a COVID-19 vaccine. It's totally fine to do that. And if they need to do it for a requirement or something else, that's fine. There has been some evidence to show that if you do wait a bit, it can improve the amount of protection that the vaccine provides. So if someone wanted to wait, the calculation would be 3 months from the date of onset of the illness, or if they were asymptomatic, 3 months from the date that they tested positive, and then get the vaccine. But you definitely want to take into consideration, what is that person's risk? Should they be waiting? If they're healthy and good immune status, they're unlikely to get infected in the next, few weeks to 3 months. But if they have other risk factors, they may want to move ahead and get the vaccine.
Thank you. And I realize that was a complicated question, so thank you for unpacking that for us. I mean, ultimately, I think we all know sometimes you only get one shot with folks, right, to have the conversation. So I'm not missing the underlining point here, which is take it when you got it, and let's keep people out of the hospital. So thank you for that. So we'll do one more question before we open it up to the group. And just a reminder for everybody watching live, please add your question to the question and answer text box below. We see a few coming in, so appreciate that. So I'd love to open this up to everybody. We're speaking, of course, to our provider community, folks from hospitals and health systems across the country. So we'd love to share best practices. What lessons have you guys learned that work when you're looking to get patients vaccinated? Have you seen things recently that is actually turning positive conversations into action and getting more shots into arms? And do you want to share that advice with your colleagues?
One thing that I was thinking earlier as Dr. Myers was speaking is that I'm glad to hear I'm not the only one, but sort of piggybacking off of the flu vaccine confidence, when I have a lot of families who get their flu vaccine annually, which is wonderful. And so I think piggybacking off of that, I know you guys come every year for your flu vaccine, and so let's go ahead and plan to add that COVID vaccine in too. I think because it seems, I'll let you know how it goes in the fall, but it seems like people have been really responding to that positively.
That's wonderful. Thank you. We're just going to move right into questions because we are seeing a few come in here, and I want to make sure we got time to answer all the questions that are coming in from our audience. So we'll start with one that we're just seeing in the chat now. Have you seen any differences of vaccine hesitancy and or literacy amongst different ethnic groups related to the COVID-19 vaccine? Dr. Ritchie, I know you spoke a little bit about treating more Hispanic populations and others. Are you seeing, I guess we'll start with you, are you seeing anything different amongst that population compared to others in your community and therefore had to employ different tactics?
I am very fortunate in that our Hispanic population that we care for is very pro-vaccine, which is wonderful. And so, fortunately, I have had a lot of positive response to getting the COVID vaccine, and not a lot of hesitancy in my Hispanic patients. Um, I don't know if the CDC has any specific numbers on that, but just in my personal experience, it's been really positive.
That's great to hear. Does anybody else have anything to add on the specific vaccine hesitancy amongst different ethnic groups?
I mean, I think we do know from COVID-19 vaccine coverage estimates that, there are disparities in COVID-19 vaccine coverage and, by race and ethnicity. And it's something certainly that CDC has worked very hard to try to close those gaps, because closing the gap on vaccine coverage is important to also, improving health equity overall and closing the disparities on the impact of morbidity and mortality from COVID-19. So that is, certainly an active area of focus to improve health equity overall and to reduce disparities from COVID-19.
Right, and that's certainly supported geographically. We've seen across the map, right? And you can see some of those disparities. So really important, I think, for us all to consider different populations while we're pushing these messages out, and make sure that we're making it culturally relevant for people. Okay, we'll keep it moving. So, and this question I ask knowing that we've kind of already went through the answer, but I want to make it completely clear for folks. So we got a question, and I'm going to probably direct this to you, Dr. Regan, but are boosters required annually? And this is going to be a two-parter, but we'll start with that. And I think that, again, I know you've kind of covered this, but I think that's a question we hear a lot from patients.
So the exact timing of future doses of COVID-19 vaccines has not been fully determined, at this time. There's still more to come. But I think, the whole aspect of it being required, there's certain instances, such as immigration requirements, and there's been some workplace requirements over the years. But I mean, there's no, overall federal requirement from CDC.
Got it. Okay, so we're gonna keep promoting it, and I think that the message to patients is, like the flu vaccine, this is how we keep people healthy and we keep you out of the hospital. But it's your choice to stay healthy yourself. Okay, thank you.
I'll just add that I think Dr. Regan already covered it, but ACIP will be meeting after we hear from FDA on the fall COVID-19 vaccine authorizations or approvals to update the COVID-19 vaccine recommendations. So exactly the timing of COVID-19 vaccination schedule has not been sort of determined going forward, but stay tuned for updates as we hear more from FDA and ACIP.
Great, that's helpful. Yeah, we did talk about that a little bit, so thank you for underscoring that point. So we got a few questions on this, so I just want to make sure I say it, even though we've covered it a little bit, but looking ahead to the fall and the winter, as people think about presenting, as I know Dr. Ritchie and Dr. Myers talked about, the concept of getting your flu shot and your COVID shot, avoiding colds, and how you can make sure you show up at your family holidays and not miss them because you're sick. How do you guys recommend talking to parents about the COVID vaccine in the context of that conversation? Maybe kind of talk about how the importance around presenting them as just a way to stay healthy, like not separating them, keeping them as a joint effort. Does anybody want to weigh in on that?
Yeah, absolutely. So, to me, I've done some previous research work around Tdap, HPV, and meningococcal vaccine, and keeping those together as one recommendation and not separating them out to make it sound like one is more important than the other or being recommended differently. So I see this similarly as providing an equally strong recommendation across the board. Also, I think bringing up the holiday piece that you just brought up, Emily, is really important. And, people's desire to travel, to be with each other and keeping each other well. So bringing up grandparents or older relatives in the family and the importance of keeping them well, just like it's really important to keep the young children well. And we know that there's a connection there that's been well studied. And so kind of that whole kind of process of this is how we keep all of the whole family well together, which is really important. And I also have done in one of my past jobs, travel medicine. And so I remind people that the dirtiest place on the airplane is the armrest of their seat. And just, in other words, we pick up viruses, infections everywhere. And we are constantly touching things and then our faces, and we cannot help it as human beings. So let's protect ourselves the best we can.
Yeah, for sure. I have travel coming up, and now I'm going to stare at that armrest, Dr. Myers. Any other ideas on how we present the COVID and the flu together, and again, how we prepare for another cold season with COVID looming and RSV as well, given where we were last year? Any other ideas?
The only thought I will share is that I think, as primary care providers, there's just so much fatigue about bringing it up over and over and over again. And I think it's just so important that we don't get fatigued and that we remember it's part of the whole well check or the whole visit to have a section or a time where we talk about these things, because, as we said this whole hour here, the more we talk about it and the more we present opportunities for questions, then we continue to build that trust with our patients and their families.
Yeah, for sure. And that really is the bedrock of these important conversations. So I appreciate you mentioning that. Okay, I've got one more question, and then I'll encourage folks. We do have a little more time left. So if you have any more questions, please throw them in the chat. But the last question we have is related to cardiac events, which I know that came up a little bit earlier. What is the incidence with vaccine compared to that with COVID-related cardiac events? I think there could be two ways we address this question, of course, related to the vaccine itself or COVID-related cardiac events post-vaccine. So does anybody want to talk about that a little bit?
I can jump in. This is Joanna Regan. So, I've posted in our chat, and maybe you can pass along a publication comparing the rates. But basically, if it depends on how cardiac events are defined. But if you're speaking specifically of myocarditis and pericarditis, it is defined as rare and significantly more common post-infection than vaccination. So I've provided a MMWR publication. I'm not sure if you could pass along, but just keep in mind it was done in a period earlier in the pandemic, and the situation may have improved since that time. I'm not sure if anyone else wants to add.
In general, when people have that question, and again, that has diminished over time, but some people still have that concern. The data is out there. It's really great that the risk of having cardiac complications from COVID far outweighs the vaccine by several fold. I mean, we're not talking just a little bit difference. And so hopefully that can help some people allay their fears. And again, I think back to what Dr. Ritchie said earlier too. She uses it as an opportunity to talk about her own children. And I have a 19-year-old and a 16-year-old. So they were both still teenagers going through the pandemic, and they were actually part of one of the clinical trials. I share that with folks as, listen, this is something I have a lot of confidence in. I would, and obviously my children did too, and we're very interested in doing it. So, if it were me, it were my decision to make, I would be far more worried about a bad outcome from having disease than I would be from having an outcome, a very, very rare outcome from receipt of a vaccine.
Yeah, thanks for sharing your story. That's really helpful. And kudos to your kids for being part of the trials. That's wonderful. Okay, go ahead.
I was just going to say, I can't agree more with what was already stated, but I do want to reassure everyone that, CDC continues to monitor the safety of COVID-19 vaccines. They've undergone one of the most intensive vaccine safety monitoring programs in, history. We continue to look at the incidence of myocarditis, and ACIP continues to weigh these data very carefully, and the benefits of COVID-19 vaccines far outweigh the risk. And as is reflected in the recommendations, vaccine is recommended for everyone 6 months. COVID-19 vaccines are recommended for everyone 6 months and older because the benefits of vaccination far outweigh the risks.
Yeah, thanks for that. I think, unfortunately, this is an area where we continue to see misinformation being spread, and why it's so important for us and the provider community to remind people of that fact. So I appreciate all your comments, and we will share the resource that Dr. Regan alluded to in the follow-up for folks. We had a few more questions come in, so I'll do one more. But it's about the elimination of the mandate for healthcare workers around the COVID vaccine, and the question is kind of, without that, how can we keep our colleagues encouraged and keep them with the same energy and enthusiasm around getting the vaccine and promoting it to patients? So I think some of the tools and the tactics we've talked about already kind of go to this, but any ideas in terms of, getting your colleagues and others within the hospital or health system on board with reminding their patients and keeping it top of mind for them?
Yeah, so many people have, added things onto their badges. Their badges, I don't know if it's being shown right here or not, but basically, for you, for me, for all, hashtag COVID vaccinated. I know a number of people, in my own institution and around other places that feel the importance of it, and so wear it proudly, and are open to talking about it with anybody, or even have one that says, ask me about COVID vaccine or what have you. It is important, right? Because we are role modeling the, best health practices for our patients and families and our each other, our coworkers, and maintaining that momentum, and finding different ways to do that, and allow people, even hesitant healthcare workers, which there definitely are, allowing them a space to ask their questions and their voice be heard, are really important as we continue, to promote vaccines in our daily jobs.
So literally wearing it on your sleeve. I love that.
Literally.
Okay, this is a very specific question, so I want to make sure we ask it. If a non-immunocompromised adult is getting a flu shot and a COVID booster this fall, is it okay to give other vaccines at the same time, like pneumonia, shingles, etc.? I'm assuming maybe our CDC colleagues have the answer to that.
I think Catherine might want to answer.
Sure, yes. So CDC does have the answer to this. And one of the best places to look for this when you're looking for specific COVID-19 vaccination guidance is the COVID-19 vaccine interim clinical considerations. And I can post that website in the chat. But as is we do with other vaccines in accordance with our immunization general best practices, routine administration of all age-appropriate vaccines simultaneously, meaning on the same clinic day, or what we're calling co-administration, is recommended. So yes. They can get their COVID-19 shot or vaccine, their flu shot, and other vaccines at the same time.
Again, a bird in the hand.
Exactly. Yes. That's what we all wanted to hear. It's easier, right? Get them all done at the same time. Okay, wonderful. Well, I will thank you and tell you all how much we appreciate having you here, Dr. Regan, Dr. Ritchie, Dr. Myers, and Dr. Fleming-Dutra. We appreciate your perspectives and your expertise that you shared with us today. And thank you to all you folks joining online as well for listening to this important discussion. We will follow this up with an email after the event that includes a variety of assets and information related to AHA's Vaccine Confidence Program that will help and support your work as you encourage patients to get the COVID-19 vaccine. We'll also include a replay of this virtual event and post it on our website in the coming days. You'll also be able to find an archive of all of our COVID-19 resources at aha.org/vaccine confidence. So thank you again to our wonderful panelists for joining us on this July Friday. We really appreciate it. And I wish everybody a wonderful day.
Thank you.
Thanks for having us.